Salicylic acid is a keratolytic, peeling agent that causes shedding of the outer layer of skin. Salicylic acid topical for the skin is used in the treatment of acne, dandruff, seborrhea or psoriasis and to remove corns, calluses and warts. How to take course and dosage. Outwardly. The drug is applied to the affected skin 2-3 times a day. The maximum daily dose for adults is 10 ml. The course of treatment is no more than 1 week. Contraindications: hypersensitivity, renal failure, childhood, pregnancy and lactation. Special instructions: do not apply the drug to birthmarks, warts, genital or facial warts. In case of contact with mucous membranes, rinse the affected area with plenty of water. Side effects: skin reactions such as peeling, burning, dry, reddened skin may occur, especially at the start of treatment. If any of these effects persist or worsen, tell your doctor or pharmacist promptly. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reactions, including rash, itching, swelling, especially of the face, tongue, throat, severe dizziness, trouble breathing.